Question 1. When evaluating a patient's progress following a total knee arthroplasty and considering adjustments to their prescribed physical and occupational therapy rehabilitation protocols, which approach best reflects current orthopedic nursing standards and ethical practice? Option A. Thoroughly assess the patient's current functional status, pain levels, and range of motion, and then collaboratively discuss any proposed modifications to the rehabilitation protocol with the patient and the interdisciplinary therapy team, ensuring the rationale for changes is clearly documented. Option B. Continue with the established rehabilitation protocol without deviation, assuming the prescribed exercises are universally beneficial for all patients recovering from a total knee arthroplasty. Option C. Unilaterally alter the rehabilitation protocol to incorporate exercises the patient has seen or heard about from other individuals, believing these might be more beneficial. Option D. Implement significant changes to the rehabilitation protocol based solely on the patient's verbal expression of discomfort, without objective assessment or consultation with the therapy team. Correct answer is A. Thoroughly assess the patient's current functional status, pain levels, and range of motion, and then collaboratively discuss any proposed modifications to the rehabilitation protocol with the patient and the interdisciplinary therapy team, ensuring the rationale for changes is clearly documented. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic nursing, balancing patient-specific needs with established rehabilitation protocols. The professional challenge lies in discerning when a deviation from a standard protocol is justified by a patient's unique presentation and when it risks compromising their recovery or safety. This requires a deep understanding of the underlying principles of physical and occupational therapy, the patient's specific orthopedic condition, and the potential impact of interventions on their functional outcomes. Careful judgment is essential to ensure evidence-based practice while maintaining patient-centered care. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's current functional status, pain levels, range of motion, and any psychosocial factors that might influence their engagement with therapy. This assessment then informs a collaborative decision-making process with the patient and the interdisciplinary team, including physical and occupational therapists. The justification for modifying a protocol stems from the principle of individualized care, which is a cornerstone of professional nursing practice. Regulatory frameworks and ethical guidelines emphasize tailoring treatment plans to meet the unique needs of each patient, ensuring that interventions are safe, effective, and promote optimal recovery. This approach aligns with the certified orthopedic nurse's responsibility to advocate for the patient and ensure their rehabilitation plan is both evidence-based and responsive to their specific circumstances. Incorrect approaches analysis. Adhering rigidly to a standard protocol without considering the patient's individual response or progress represents a failure to provide individualized care. This can lead to ineffective treatment, patient frustration, and potentially delayed recovery. Ethically, it violates the principle of beneficence, as the care provided may not be in the patient's best interest. Regulatory failure occurs if the nursing standard of care, which mandates patient-centered care, is not met. Implementing a rehabilitation protocol based solely on the patient's subjective complaints without objective assessment or consultation with therapy professionals is also problematic. While patient feedback is crucial, it must be integrated with objective data to guide treatment decisions. This approach risks misinterpreting symptoms, leading to inappropriate interventions or a failure to address underlying issues. It can also undermine the expertise of the therapy team and create a fragmented care plan, potentially violating collaborative practice guidelines. Making unilateral decisions to significantly alter a rehabilitation protocol without consulting the patient or the interdisciplinary team is a serious ethical and regulatory breach. This undermines the collaborative nature of patient care, disrespects the patient's autonomy, and bypasses the expertise of other healthcare professionals. Such actions can lead to patient harm, compromise the integrity of the rehabilitation process, and violate professional standards of practice that require interdisciplinary communication and shared decision-making. Professional reasoning. Professionals should approach rehabilitation protocol decisions by first conducting a thorough, objective, and subjective patient assessment. This assessment should then be used to inform a discussion with the patient about their goals and any concerns they have. Following this, A collaborative consultation with the physical and occupational therapy team is essential to review the patient's progress and discuss any proposed modifications to the established protocol. The decision-making process should be documented, clearly outlining the rationale for any changes and the expected outcomes, ensuring accountability and continuity of care. Question 2. The control framework reveals a certified orthopedic nurse is caring for a patient who has been on strict bed rest for an extended period following a complex fracture. The nurse needs to assess the potential impact of this immobility on the patient's connective tissues. Which of the following assessment strategies would best identify early signs of compromised ligaments, tendons, and cartilage due to disuse atrophy and reduced lubrication? Option A. Administering pain medication as prescribed and documenting the patient's subjective pain scores at regular intervals. Option B. Observing the patient's skin integrity for pressure ulcers, as this is a primary concern for prolonged immobility. Option C. Reviewing the patient's dietary intake logs for adequate protein and calcium consumption, as these are essential for connective tissue repair. Option D. Evaluating the patient's ability to perform active and passive range of motion exercises in all affected and contralateral joints, noting any crepitus, stiffness, or pain. The correct answer is D. Evaluating the patient's ability to perform active and passive range of motion exercises in all affected and contralateral joints, noting any crepitus, stiffness, or pain. Explanation. The control framework reveals a scenario where a certified orthopedic nurse must assess the impact of a patient's prolonged immobility on their connective tissues, specifically ligaments, tendons, and cartilage. This scenario is professionally challenging because the subtle, cumulative effects of immobility on these tissues can lead to significant functional decline if not identified and managed proactively. The nurse must apply in-depth knowledge of orthopedic physiology and the principles of patient care within the established regulatory and ethical guidelines for orthopedic nursing practice. The correct approach involves a comprehensive assessment of the patient's current functional status, including range of motion, gait analysis, if applicable, and palpation for tenderness or swelling in affected joints. This approach represents best professional practice because it directly addresses the potential for deconditioning and injury to ligaments, tendons, and cartilage due to reduced mechanical loading. Adherence to evidence-based practice guidelines for orthopedic patient care, which emphasize early mobilization and appropriate therapeutic interventions, is paramount. This aligns with the regulatory framework's mandate for nurses to provide competent, evidence-based care that promotes patient recovery and prevents complications. Ethical principles of beneficence and non-maleficence require the nurse to act in the patient's best interest and avoid harm, which includes preventing the long-term consequences of connective tissue degradation. An incorrect approach would be to solely rely on the patient's subjective report of pain without performing objective assessments. This fails to meet professional standards as it neglects the objective signs of connective tissue compromise that may not be immediately apparent or articulated by the patient. It also risks delaying necessary interventions, potentially violating the regulatory requirement for timely and appropriate care. Another incorrect approach would be to focus only on the immediate post-operative surgical site and overlook the systemic effects of immobility on other joints and connective tissues. This demonstrates a lack of holistic patient assessment, which is a cornerstone of professional nursing practice and a likely implicit requirement within the orthopedic nursing regulatory framework. It could lead to misdiagnosis of secondary connective tissue issues. A third incorrect approach would be to implement a generic exercise protocol without considering the specific connective tissues affected by the patient's condition and immobility. This lacks the individualized, patient-centered care mandated by professional standards and regulatory bodies. It could inadvertently exacerbate existing issues or fail to address the unique needs of the patient's compromised ligaments, tendons, or cartilage, thereby failing to uphold the duty of care. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the patient's diagnosis and the expected impact on their musculoskeletal system. Second, conducting a comprehensive physical assessment, integrating subjective and objective data. Third, consulting relevant evidence-based practice guidelines and protocols for orthopedic patient management. Fourth, collaborating with the interdisciplinary healthcare team to develop and implement a tailored care plan. Finally, continuously monitoring the patient's response to interventions and adjusting the plan as needed, always within the scope of practice and regulatory requirements. Question 3. The efficiency study reveals that a patient recovering from a knee injury reports significant difficulty with bending and straightening their leg, but no issues with lifting the leg sideways. Based on the biomechanical principles of joint movement, which type of synovial joint and its primary movements are most relevant to this patient's reported limitations? Option A. Ball and socket joint, characterized by circumduction and rotation. Option B. Hinge joint, characterized by flexion and extension. Option C. Pivot joint, characterized by rotation. Option D. Gliding joint, characterized by gliding or sliding movements. The correct answer is B. Hinge joint, characterized by flexion and extension. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic nursing, where a patient's mobility and pain management are directly linked to understanding joint mechanics. The challenge lies in accurately assessing the patient's reported limitations and translating them into appropriate nursing interventions. Misinterpreting the type of joint movement or the underlying joint structure can lead to ineffective care plans, delayed recovery, and potential patient dissatisfaction or harm. The nurse must possess a strong foundational knowledge of anatomy and biomechanics to provide evidence-based care. Correct approach analysis. The correct approach demonstrates a thorough understanding of the synovial joint classifications and their associated movements. By identifying the knee as a hinge joint, the nurse correctly associates it with flexion and extension. This accurate assessment allows for the development of a targeted care plan that addresses the patient's specific limitations within the functional capacity of that joint. This aligns with best professional practice by ensuring that nursing interventions are based on accurate anatomical and physiological principles, leading to more effective patient outcomes and adherence to standards of care that emphasize evidence-based practice. Incorrect approaches analysis. One incorrect approach might involve misclassifying the knee joint. For instance, if the knee were incorrectly identified as a ball and socket joint, the nurse might erroneously consider abduction and adduction as primary movements to assess or address, which are not characteristic of a hinge joint. This would be a failure to adhere to fundamental anatomical knowledge, a core competency for orthopedic nurses, and could lead to inappropriate therapeutic exercises or assessments, potentially causing further injury or hindering recovery. This represents a significant lapse in professional judgment and a deviation from the expected standard of care. Another incorrect approach could be to focus on movements not typically associated with the primary function of a hinge joint, such as rotation. While some minor rotation may occur in the knee, it is not its defining movement. Focusing on this would be a misapplication of anatomical knowledge and could lead to interventions that are not beneficial or even detrimental to the patient's recovery from a knee injury. This demonstrates a lack of understanding of biomechanical principles relevant to orthopedic care and a failure to apply knowledge in a clinically relevant manner, violating ethical obligations to provide competent care. Professional reasoning. Professionals should employ a systematic approach when assessing joint function. This involves 1. Actively listening to the patient's description of their limitations and pain. 2. Correlating the patient's report with knowledge of joint anatomy and biomechanics. 3. Identifying the specific joint involved and its classification e.g., hinge, ball and socket, pivot. 4. Determining the primary movements associated with that joint type. 5. Assessing the patient's ability to perform these specific movements. 6. Developing a care plan that addresses the identified deficits within the functional capabilities of the joint, always prioritizing patient safety and evidence-based practice. Question 4. The risk matrix shows a moderate likelihood of patient dissatisfaction due to inconsistent pain management following orthopedic surgery. As a certified orthopedic nurse, you are reviewing a patient's chart and observe the following documentation regarding pain. Patient reports pain. Pain level 8/10. What is the most appropriate next step to ensure best professional practice and regulatory compliance? Option A. Ask the patient to rate their pain again in 1 hour and document the new score. Option B. Document that the patient is experiencing pain and that further assessment is not immediately necessary as the pain score is high. Option C. Add a detailed description of the pain's location, quality, and any factors that exacerbate or alleviate it, along with the patient's response to any administered analgesia. Option D. Note that the patient is reporting pain and that it is severe. assuming the physician will adjust the pain medication. The correct answer is C. Add a detailed description of the pain's location, quality, and any factors that exacerbate or alleviate it, along with the patient's response to any administered analgesia. Explanation. Scenario analysis. This scenario is professionally challenging because accurately assessing and documenting a patient's pain is fundamental to orthopedic care, directly impacting treatment efficacy and patient well-being. The challenge lies in the subjective nature of pain and the need for consistent, objective documentation that meets regulatory standards and facilitates effective interdisciplinary communication. Failure to do so can lead to undertreatment, delayed recovery, and potential patient harm, all of which carry significant professional and legal ramifications. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, validated pain assessment tool and ensures meticulous, timely documentation. Utilizing a recognized scale, e.g., numeric rating scale, Wong-Baker Faces Pain Rating Scale, provides a standardized, quantifiable measure of pain intensity. Documenting this alongside the patient's description of pain location, quality, alleviating/aggravating factors, and the nurse's objective observations, e.g., guarding, grimacing, creates a complete picture. This detailed record is crucial for tracking pain trends, evaluating the effectiveness of interventions, and communicating vital information to the healthcare team, aligning with professional nursing standards and regulatory requirements for accurate patient charting. Incorrect approaches analysis. One incorrect approach involves relying solely on the patient's verbal report without using a standardized scale or documenting specific details. This is a regulatory failure as it lacks objective data and can lead to inconsistent pain management. Ethically, it may not fully advocate for the patient's needs if their pain is not adequately quantified. Another incorrect approach is to document pain as patient states pain is 7/10 without further context. This is a regulatory failure because it omits crucial details about the pain's characteristics and the patient's subjective experience beyond a number. It hinders the ability of other providers to understand the full scope of the pain and its impact. A third incorrect approach is to document pain assessment only when the patient explicitly complains. This is a regulatory and ethical failure. Regulations often mandate proactive and regular pain assessments, not just reactive ones. Ethically, it can lead to patients suffering in silence and not receiving timely interventions, failing the nursing duty of care. Professional reasoning. Professionals should employ a systematic decision-making process that begins with recognizing pain as the fifth vital sign. This involves selecting an appropriate validated pain assessment tool based on the patient's age, cognitive status, and condition. Following assessment, detailed, objective, and subjective documentation must be completed promptly. This documentation should include the chosen scale score, the patient's description of the pain, any observed nonverbal cues, the intervention provided, and the patient's response to the intervention. This cyclical process of assess, document, intervene, and reassess ensures continuous, high-quality pain management and compliance with professional and regulatory standards. Question 5. The assessment process reveals a patient presenting with new-onset weakness and numbness in the lateral aspect of their foot and toes following a tibial plateau fracture repair. Considering the neuroanatomy related to musculoskeletal function, which of the following assessment findings would most strongly suggest a potential compromise of the common peroneal nerve? Option A. Decreased plantar flexion strength and reduced sensation on the sole of the foot. Option B. Inability to abduct and adduct the fingers, with altered sensation on the palmar surface of the hand. Option C. Impaired dorsiflexion of the foot and toes, with diminished sensation over the dorsum of the foot and the web space between the great and second toes. Option D. Weakness in hip abduction and reduced sensation over the lateral aspect of the thigh. The correct answer is C. Impaired dorsiflexion of the foot and toes, with diminished sensation over the dorsum of the foot and the web space between the great and second toes. Explanation. The assessment process reveals a patient presenting with new-onset foot drop and sensory deficits in the lower extremities following a recent orthopedic surgery. This scenario is professionally challenging because it requires the certified orthopedic nurse to integrate knowledge of neuroanatomy with the patient's surgical history and current presentation to accurately identify the potential cause of the neurological deficit. Differentiating between a direct nerve injury during surgery, post-operative inflammation, or a systemic complication necessitates a thorough and systematic approach. Careful judgment is required to avoid misdiagnosis, delayed treatment, and potential patient harm. The correct approach represents best professional practice because it prioritizes a comprehensive neuroanatomical assessment to pinpoint the affected nerve pathways and their relationship to the musculoskeletal structures involved in the surgery. This aligns with the ethical and professional obligation to provide patient-centered care based on accurate assessment and evidence-based practice. By systematically evaluating motor and sensory function along specific dermatomes and myotomes, the nurse can begin to localize the neurological deficit, which is crucial for guiding further diagnostic investigations and informing the surgical or medical team. This approach is consistent with the standards of practice for orthopedic nursing, emphasizing the importance of understanding the intricate relationship between the nervous and musculoskeletal systems. An incorrect approach that focuses solely on the orthopedic surgical site without considering the broader neuroanatomical implications would be a regulatory and ethical failure. This would neglect the nurse's responsibility to assess for potential complications beyond the immediate surgical field, potentially delaying the identification of a nerve-related issue. Another incorrect approach, such as attributing the symptoms to general postoperative pain or immobility without a detailed neurological examination, would be a failure to adhere to professional standards of care and could lead to a misdiagnosis and inappropriate management. Relying on anecdotal evidence or the opinions of non-qualified personnel without a systematic assessment would also represent a significant ethical lapse and a failure to uphold professional accountability. The professional decision-making process for similar situations should involve a structured approach. First, gather a thorough patient history, including the nature of the orthopedic issue, the surgical procedure performed, and the onset and progression of new symptoms. Second, conduct a comprehensive physical examination with a specific focus on neurological assessment, including motor strength, sensory perception, reflexes, and coordination, correlating findings with known neuroanatomical pathways. Third, integrate assessment findings with the patient's medical and surgical history to formulate a differential diagnosis. Fourth, communicate findings clearly and promptly to the interdisciplinary healthcare team, including the orthopedic surgeon and neurologist, to facilitate timely and appropriate diagnostic testing and management. Finally, continuously monitor the patient's response to interventions and reassess as needed, documenting all findings and actions meticulously. Question 6. Benchmark analysis indicates that a certified orthopedic nurse is caring for an elderly patient who has been diagnosed with severe osteoarthritis, requiring a total knee replacement. The patient expresses significant anxiety and repeatedly questions the necessity of the surgery, stating they don't want to be cut open. The nurse observes the patient seems to understand the basic explanation of the procedure, but appears overwhelmed by the potential complications discussed. The nurse also notes that the patient's adult child, who is present, is strongly encouraging the surgery, emphasizing the patient's declining mobility. What is the most ethically and professionally appropriate course of action for the certified orthopedic nurse? Option A. Initiate a formal capacity assessment process involving the orthopedic surgeon and potentially a geriatric psychiatrist or ethics committee to objectively determine the patient's ability to make informed decisions, while continuing to provide emotional support and education to the patient and their family. Option B. Proceed with the surgical preparation as scheduled, assuming the patient's child is acting in the patient's best interest and the surgeon has adequately addressed all medical concerns. Option C. Gently but firmly reassure the patient that the surgery is the only viable option for mobility and encourage them to trust the medical team's judgment, downplaying their expressed anxieties. Option D. Document the patient's expressed anxieties and the child's encouragement in the medical record, and then inform the orthopedic surgeon that the patient is hesitant, leaving further discussion and decision-making solely to the surgeon. The correct answer is A. Initiate a formal capacity assessment process involving the orthopedic surgeon and potentially a geriatric psychiatrist or ethics committee to objectively determine the patient's ability to make informed decisions, while continuing to provide emotional support and education to the patient and their family. Explanation. Scenario analysis. This scenario presents an ethical dilemma for a certified orthopedic nurse regarding patient autonomy versus the nurse's professional judgment about a patient's capacity to make informed decisions about their care, specifically concerning a complex surgical intervention. The challenge lies in balancing the patient's right to self-determination with the nurse's responsibility to ensure patient safety and well-being, particularly when there are concerns about the patient's understanding of risk and benefits. The nurse must navigate potential biases and ensure the patient's decision-making process is truly informed and free from coercion. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes patient advocacy and thorough assessment. This includes engaging in open communication with the patient to assess their understanding of the proposed surgery, its risks, benefits, and alternatives. It also necessitates consulting with the orthopedic surgeon to gain a clearer picture of the medical necessity and potential outcomes, and importantly, involving the patient's designated healthcare proxy or family if the patient's capacity is genuinely in question. Following established protocols for capacity assessment. This approach aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy, as well as regulatory guidelines that mandate patient-centered care and informed consent processes. The certified orthopedic nurse's role is to facilitate informed decision-making, not to make the decision for the patient, unless the patient lacks capacity and a legal representative is involved. Incorrect approach is analysis. One incorrect approach would be to immediately override the patient's decision based solely on the nurse's perception of risk without a formal capacity assessment or further consultation. This violates the principle of patient autonomy and could lead to a breach of professional conduct and potentially legal repercussions for infringing on the patient's rights. It also fails to uphold the nurse's duty to advocate for the patient and explore all avenues to ensure understanding. Another incorrect approach would be to proceed with the surgery without adequately addressing the nurse's concerns about the patient's understanding, assuming the surgeon has already obtained informed consent. This neglects the nurse's independent professional responsibility to ensure patient safety and advocate for their needs. It could be seen as a failure to report potential issues and a dereliction of duty, potentially leading to adverse patient outcomes and professional censure. A third incorrect approach would be to dismiss the patient's concerns about the surgery and pressure them to agree to it, citing the surgeon's recommendation. This is coercive and undermines the informed consent process. It disregards the patient's right to express doubts and seek further clarification, violating ethical principles of respect for persons, and potentially leading to a situation where consent is not truly voluntary. Professional reasoning. Professionals should employ a systematic decision-making process that begins with active listening and open communication to understand the patient's perspective and concerns. This should be followed by a comprehensive assessment of the patient's understanding of their condition and treatment options, utilizing validated tools or protocols if available. Collaboration with the interdisciplinary team, including physicians and other healthcare providers, is crucial to gather all necessary information. If there are doubts about the patient's capacity, the established institutional policy for capacity assessment should be followed, which may involve a formal evaluation and the involvement of a legal representative if indicated. Throughout this process, the nurse must remain an advocate for the patient, ensuring their rights are protected and their decisions are informed and voluntary. Question 7. Governance review demonstrates a recent increase in post-operative orthopedic patients reporting persistent moderate to severe pain despite initial opioid prescriptions. The nursing team is considering strategies to improve pain management outcomes. Which of the following approaches best aligns with current best practices and regulatory guidance for managing opioid use in this population? Option A. Implement a multimodal pain management plan that includes scheduled non-opioid analgesics and adjuvant medications to reduce opioid reliance. Option B. Focus exclusively on non-pharmacological interventions such as physical therapy and ice packs, without considering pharmacological adjuncts. Option C. Discontinue all opioid analgesics immediately and rely solely on non-pharmacological pain relief methods. Option D. Increase the prescribed opioid dosage and frequency for patients reporting inadequate pain relief. The correct answer is D. Increase the prescribed opioid dosage and frequency for patients reporting inadequate pain relief. Explanation. Scenario analysis. This scenario is professionally challenging due to the inherent risks associated with opioid analgesia, including the potential for dependence, overdose, and diversion, alongside the need to effectively manage severe orthopedic pain. The certified orthopedic nurse must balance the patient's immediate need for pain relief with long-term safety and adherence to prescribing guidelines and best practices. This requires a nuanced understanding of pharmacodynamics, patient assessment, and interdisciplinary collaboration. Correct approach analysis. The correct approach prioritizes a multimodal pain management strategy that includes non-opioid analgesics and adjuvant medications to reduce opioid reliance. This aligns with current evidence-based practice and regulatory guidelines, such as those from the Centers for Disease Control and Prevention, CDC, on opioid prescribing, which advocate for the lowest effective dose for the shortest duration. Utilizing adjuvant medications like gabapentinoids or NSAID can target different pain pathways, enhancing analgesia and potentially allowing for lower opioid doses, thereby mitigating risks. This approach demonstrates a commitment to patient safety, adherence to professional standards of care, and responsible medication stewardship. Incorrect approaches analysis. One incorrect approach involves solely increasing the opioid dosage without exploring alternative or adjunctive therapies. This fails to adhere to guidelines that emphasize minimizing opioid exposure and risks. It could lead to increased risk of opioid-induced side effects, tolerance, and dependence, and may not be the most effective long-term strategy for pain management. Ethically, it neglects the principle of non-maleficence by potentially exposing the patient to undue harm. Another incorrect approach is to discontinue all opioid analgesia abruptly without a clear transition plan or adequate alternative pain relief. This can lead to severe withdrawal symptoms and uncontrolled pain, violating the ethical principle of beneficence by failing to adequately relieve suffering. It also disregards the patient's current functional status and pain report, potentially leading to significant distress and functional impairment. A third incorrect approach is to rely exclusively on non-pharmacological interventions without considering the severity of the patient's pain and the established efficacy of pharmacological agents in orthopedic postoperative settings. While non-pharmacological methods are valuable adjuncts, they may not provide sufficient relief for acute, severe pain, leading to undertreated pain and patient dissatisfaction. This approach could be seen as a failure to adequately assess and treat the patient's pain, potentially contravening professional standards. Professional reasoning. Professionals should employ a systematic approach to pain management. This begins with a comprehensive assessment of pain characteristics, including intensity, location, quality, and impact on function. Next, a multimodal treatment plan should be developed collaboratively with the patient and the interdisciplinary team, incorporating pharmacological opioids and adjuvants and non-pharmacological interventions. Regular reassessment of pain and functional status is crucial to titrate therapy and monitor for adverse effects. Documentation should clearly reflect the rationale for treatment choices, patient response, and any adjustments made. This iterative process ensures that pain is managed effectively and safely, adhering to both regulatory requirements and ethical obligations. Question 8. Operational review demonstrates that a patient admitted for a scheduled orthopedic surgery for a tibial plateau fracture has undergone a postoperative MRI. The MRI report indicates a small, stable meniscal tear not previously identified on preoperative X-rays or CT scans. The patient reports minimal postoperative pain, is ambulating with minimal assistance, and denies any new mechanical symptoms in the knee. The orthopedic nurse is reviewing the MRI report and the patient's current clinical status. Which of the following actions best reflects the certified orthopedic nurse's role in this situation, adhering to regulatory frameworks and best practices for diagnostic imaging interpretation and patient management? Option A. Discuss the MRI findings with the orthopedic physician, presenting a summary of the patient's current clinical status and the imaging report to collaboratively determine the next steps in management. Option B. Inform the patient that the MRI confirms a complication requiring immediate surgical intervention to repair the meniscal tear. Option C. Advise the patient that the MRI finding is likely incidental and not related to their current symptoms, and no further action is needed. Option D. Immediately recommend a change in the patient's postoperative physical therapy regimen to focus on specific exercises to address the newly identified meniscal tear. The correct answer is A. Discuss the MRI findings with the orthopedic physician, presenting a summary of the patient's current clinical status and the imaging report to collaboratively determine the next steps in management. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic nursing, interpreting and acting upon diagnostic imaging findings in the context of a patient's evolving clinical presentation. The challenge lies in balancing the objective data from imaging with the subjective and objective findings from direct patient assessment, while adhering to established protocols and ensuring patient safety and optimal outcomes. The nurse must critically evaluate the information, recognize potential discrepancies, and initiate appropriate actions within their scope of practice and regulatory guidelines. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient, including a thorough review of their current symptoms, pain levels, functional status, and any recent changes. This is followed by a detailed examination of the diagnostic imaging reports, cross-referencing the findings with the patient's clinical picture. The nurse then collaborates with the orthopedic physician, presenting a synthesized overview of the patient's condition and imaging results, and advocating for further investigation or treatment adjustments based on this holistic evaluation. This approach aligns with the certified orthopedic nurse's responsibility to provide evidence-based, patient-centered care, ensuring that diagnostic information is integrated into a broader clinical context. It upholds ethical principles of beneficence and non-maleficence by prioritizing accurate diagnosis and appropriate intervention, and adheres to professional standards that mandate interdisciplinary communication and patient advocacy. Incorrect approaches analysis. One incorrect approach is to solely rely on the radiologist's report without correlating it with the patient's current clinical status. This fails to acknowledge that imaging findings can be static while a patient's condition is dynamic. A radiologist's report may highlight findings that are not currently symptomatic or may miss subtle clinical cues that a bedside assessment would reveal. This approach risks misinterpreting the significance of imaging results and can lead to delayed or inappropriate treatment. Ethically, it falls short of providing comprehensive care and can be considered a failure in due diligence. Another incorrect approach is to dismiss the imaging findings entirely if they do not immediately align with the nurse's initial clinical impression, without further investigation. While clinical judgment is crucial, outright dismissal of objective diagnostic data without a systematic review and discussion with the physician can lead to overlooking significant pathology. This can result in a failure to diagnose or treat serious conditions, potentially harming the patient. It represents a failure to integrate all available data for optimal patient care and may violate professional standards of practice that emphasize thoroughness. Third incorrect approach is to independently alter the patient's treatment plan based solely on the imaging report, without consulting the orthopedic physician. This oversteps the scope of practice for an orthopedic nurse and bypasses the established chain of command and collaborative decision-making process. It poses a significant risk to patient safety, as treatment decisions require the expertise of the physician, who is ultimately responsible for the patient's medical management. This action constitutes a breach of professional boundaries and regulatory guidelines. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment. This includes gathering subjective data, patient's report of symptoms, and objective data, physical examination findings, vital signs. Concurrently, they must critically review all diagnostic imaging reports, understanding the limitations and potential interpretations of each modality. The next crucial step is to synthesize these two streams of information, identifying any correlations or discrepancies. When discrepancies arise, or when the imaging findings suggest a significant change in the patient's condition, the professional must initiate communication with the orthopedic physician, presenting a clear and concise summary of the patient's status and imaging results. This collaborative approach ensures that diagnostic information is used effectively to guide patient care, promoting optimal outcomes and upholding the highest standards of professional practice and patient safety. Question 9. Market research demonstrates that patients often have misconceptions about bone health. A certified orthopedic nurse is educating a patient who expresses a strong belief that consuming excessive amounts of calcium supplements alone will ensure strong bones, despite a sedentary lifestyle and poor dietary habits otherwise. The nurse knows that bone strength is a complex interplay of bone remodeling, influenced by mechanical stress, hormonal balance, and adequate intake of various nutrients, not just calcium. The patient is resistant to discussing other factors, stating, "I've done my research and calcium is all that matters." How should the nurse best proceed? Option A. Directly contradict the patient's statement, emphasizing that their understanding is incorrect and that without exercise and a balanced diet, calcium supplements will be largely ineffective. Option B. Gently explain that while calcium is important, bone strength is a complex process involving bone remodeling by osteoblasts and osteoclasts, and that mechanical stress from exercise and a balanced diet are crucial for optimal bone health. Offer to provide resources on these interconnected factors. Option C. Acknowledge the patient's belief about calcium, but avoid further discussion on other factors to respect their stated preference and avoid conflict. Option D. Agree with the patient's focus on calcium supplements, as this is their stated priority, and defer any discussion of other bone health components to a future, less resistant conversation. The correct answer is B. Gently explain that while calcium is important, bone strength is a complex process involving bone remodeling by osteoblasts and osteoclasts, and that mechanical stress from exercise and a balanced diet are crucial for optimal bone health. Offer to provide resources on these interconnected factors. Explanation. This scenario presents an ethical dilemma for a certified orthopedic nurse regarding patient autonomy and the nurse's professional responsibility in educating patients about their bone health. The challenge lies in balancing the patient's right to make informed decisions with the nurse's duty to provide accurate and comprehensive information, especially when the patient's stated preference might lead to suboptimal outcomes due to a misunderstanding of bone physiology. The nurse must navigate this delicate situation without overstepping professional boundaries or resorting to paternalistic practices. The correct approach represents best professional practice because it prioritizes patient education and empowerment. By explaining the role of osteoblasts and osteoclasts in bone remodeling and how factors like nutrition and exercise influence these processes, the nurse provides the patient with the necessary knowledge to make an informed decision about their lifestyle choices. This aligns with ethical principles of beneficence, acting in the patient's best interest through education and respect for autonomy, allowing the patient to make their own choices based on understanding. Furthermore, it adheres to professional nursing standards that emphasize patient teaching and advocacy. An incorrect approach that dismisses the patient's request without further explanation fails to uphold the principle of respect for autonomy. It assumes the patient's request is inherently flawed without attempting to understand the underlying reasoning or provide corrective information, potentially leading to patient frustration and a breakdown in the therapeutic relationship. This could be seen as a failure in patient advocacy and a lack of commitment to comprehensive patient education, which are core tenets of professional nursing practice. Another incorrect approach that involves directly contradicting the patient's stated preference and insisting on a specific dietary regimen, even if medically sound, oversteps professional boundaries. While the nurse may have superior knowledge, imposing a treatment plan without patient buy-in or understanding can be perceived as paternalistic and disrespectful of the patient's right to self-determination. This approach neglects the crucial element of shared decision-making and can erode trust. A further incorrect approach that involves simply agreeing with the patient's misconception without providing any educational context or offering alternative perspectives fails to act in the patient's best interest. While it avoids direct confrontation, it does not fulfill the nurse's ethical obligation to promote health and prevent harm through education. This passive approach can lead to the patient continuing with potentially detrimental lifestyle choices due to a lack of accurate information about bone structure and function. The professional decision-making process in such situations should involve active listening to understand the patient's perspective, assessing the patient's current knowledge base, providing clear and accurate information tailored to the patient's understanding, exploring the patient's rationale for their preferences, and collaboratively developing a plan that respects both the patient's autonomy and the nurse's professional expertise. Question 10. The performance metrics show a slight increase in the time taken for initial management of patients presenting with suspected limb fractures or dislocations. Considering the certified orthopedic nurse's role in process optimization for traumatic injuries, which of the following approaches best addresses this trend while adhering to established orthopedic nursing standards and patient safety protocols? Option A. Focus on educating patients about the importance of early mobilization after injury to expedite their recovery timeline. Option B. Prioritize the administration of long-acting analgesics upon patient arrival, regardless of the initial assessment findings, to ensure immediate pain relief. Option C. Implement a standardized pre-hospital triage protocol for orthopedic trauma to ensure rapid identification and initial stabilization of suspected fractures and dislocations before patient arrival at the facility. Option D. Conduct a comprehensive review of all diagnostic imaging requests for orthopedic injuries to identify potential delays in the radiology department. The correct answer is C. Implement a standardized pre-hospital triage protocol for orthopedic trauma to ensure rapid identification and initial stabilization of suspected fractures and dislocations before patient arrival at the facility. Explanation. Scenario analysis. This scenario is professionally challenging due to the critical nature of orthopedic trauma. Mismanagement of fractures, dislocations, or sprains can lead to long-term disability, chronic pain, and significant impact on a patient's quality of life. The nurse must rapidly assess, prioritize interventions, and communicate effectively within a dynamic environment, often with limited information initially. Ensuring adherence to established protocols and best practices is paramount to optimize patient outcomes and prevent iatrogenic harm. Correct approach analysis. The correct approach prioritizes immediate, life-sustaining interventions and stabilization of the injured limb, aligning with the core principles of emergency care and orthopedic nursing. This involves a systematic assessment to identify the extent of the injury, followed by appropriate immobilization techniques to prevent further damage, reduce pain, and prepare the patient for definitive treatment. This approach is justified by regulatory frameworks that mandate patient safety, evidence-based practice, and the nurse's role in the initial management of acute orthopedic conditions. It reflects a commitment to minimizing complications and promoting optimal healing. Incorrect approaches analysis. An approach that delays definitive pain management and focuses solely on diagnostic imaging without initial stabilization is incorrect. This fails to address the immediate suffering of the patient and risks exacerbating the injury by allowing uncontrolled movement. Ethically, it violates the principle of beneficence by not alleviating pain promptly. Regulatory frameworks emphasize timely pain assessment and management as a fundamental aspect of patient care. An approach that relies on anecdotal evidence or the patient's self-diagnosis without a thorough orthopedic assessment is professionally unacceptable. It bypasses established protocols for trauma management and can lead to misdiagnosis or delayed appropriate treatment. It is a failure to adhere to evidence-based practice, a cornerstone of professional nursing, and could result in significant harm to the patient, violating the principle of non-maleficence. An approach that focuses on long-term rehabilitation strategies before addressing the acute fracture or dislocation is premature and incorrect. While rehabilitation is crucial, it is not the priority in the immediate post-injury phase. This misallocation of resources and focus can delay essential interventions for the acute injury, potentially compromising the healing process and leading to poorer outcomes. It demonstrates a lack of understanding of the sequential nature of orthopedic trauma management. Professional reasoning. Professionals should employ a structured decision-making process that begins with a rapid assessment of the patient's overall condition, followed by a focused orthopedic assessment. This involves applying knowledge of anatomy, physiology, and common orthopedic injuries. The nurse should then consult established protocols and guidelines for the management of fractures, dislocations, and sprains, prioritizing interventions based on their potential impact on patient safety and recovery. Effective communication with the interdisciplinary team, including physicians and other healthcare providers, is essential for coordinated care and optimal patient outcomes. Continuous evaluation of the patient's response to interventions and adaptation of the care plan are also critical components of professional practice. Question 11. The risk matrix shows a moderate likelihood of a patient experiencing increased post-operative pain and a high impact on their recovery if pain is inadequately managed. You are assessing a patient who underwent a total knee replacement 48 hours ago. The patient states, "My pain is still pretty bad, even with the medication." Your standard protocol involves checking the pain score and the last administered analgesic. However, recall this patient has consistently reported moderate pain since surgery, and the current score is a 6/10, consistent with previous reports. Considering the patient's statement and the established assessment protocols, which of the following represents the most appropriate nursing action? Option A. Reassure the patient that pain is expected after surgery and that their current pain score is within acceptable limits for this stage of recovery. Option B. Perform a comprehensive pain assessment, exploring the quality, location, radiation, aggravating and alleviating factors, and the impact of pain on the patient's ability to perform exercises, in addition to checking the analgesic schedule. Option C. Administer the next scheduled dose of analgesic and document the current pain score, as it is within the patient's reported range. Option D. Document the patient's statement and inform the physician that the patient is reporting pain, without further immediate assessment, as the pain score is not significantly elevated from previous reports. The correct answer is C. Administer the next scheduled dose of analgesic and document the current pain score, as it is within the patient's reported range. Explanation: the risk matrix shows a high probability of patient dissatisfaction and potential for a formal complaint due to a perceived lack of thoroughness in pain assessment. This scenario is professionally challenging because it pits the nurse's time constraints and established routine against the patient's subjective experience and the ethical imperative to provide individualized, comprehensive care. The nurse must balance efficiency with the fundamental principles of patient advocacy and evidence-based practice. The correct approach represents best professional practice because it prioritizes the patient's reported experience and adheres to the established standards of orthopedic nursing assessment. Thoroughly exploring the patient's pain, including its characteristics, impact, and the effectiveness of current interventions, is a core competency. This approach aligns with the ethical principle of beneficence, acting in the patient's best interest and non-maleficence, avoiding harm by not undertreating pain. It also upholds the professional standard of care, which mandates individualized patient assessment, not a one-size-fits-all approach. Regulatory frameworks for nursing practice emphasize the importance of accurate and complete patient assessments as the foundation for safe and effective care. An incorrect approach that relies solely on the patient's previous pain scores or assumes current interventions are adequate fails to acknowledge the dynamic nature of pain and the potential for changes in the patient's condition or response to treatment. This could lead to undertreatment of pain, violating the ethical duty to alleviate suffering and potentially causing harm. Such an approach may also contravene regulatory guidelines that require nurses to reassess patients, particularly when there are indications of a change in status or patient distress. Another incorrect approach that dismisses the patient's concerns as simply seeking attention or being overly sensitive disregards the patient's autonomy and right to express their experience. This is ethically unsound, as it devalues the patient's perspective and can erode trust in the nurse-patient relationship. Professionally, it represents a failure to practice with empathy and respect, which are critical components of patient-centered care, and are often implicitly or explicitly required by professional nursing standards and ethical codes. The professional decision-making process for similar situations involves a systematic approach. 1. Recognize and acknowledge the patient's reported concern. 2. Conduct a comprehensive assessment tailored to the reported issue, utilizing appropriate orthopedic nursing techniques. 3. Evaluate the findings in relation to the patient's baseline and current treatment plan. 4. Collaborate with the patient and the interdisciplinary team to adjust the plan of care as needed. 5. Document all assessments, interventions, and outcomes thoroughly. This process ensures that patient care is responsive, evidence-based, and ethically sound, while also meeting regulatory requirements for documentation and practice. Question 12. Process analysis reveals a patient, 48 hours post-total knee arthroplasty, reports increasing pain that is not fully managed by prescribed analgesics. The nurse observes moderate swelling and erythema around the surgical site, with warmth to the touch. The patient denies fever or chills. Considering the pathophysiology of musculoskeletal disorders and post-operative recovery, which of the following assessment strategies best guides the nurse's next steps in evaluating the patient's condition? Option A. Reassure the patient that increased pain is expected after surgery and focus solely on monitoring vital signs for any significant deviations. Option B. Immediately administer a stronger analgesic and document the patient's pain level, assuming the increased pain is a normal progression of post-operative discomfort. Option C. Prioritize a comprehensive neurological assessment, including detailed sensory and motor function testing, without initially correlating it with the reported pain and localized inflammatory signs. Option D. Focus on the patient's subjective report of pain and the objective signs of inflammation, comparing them against the expected postoperative inflammatory response for this procedure, while also actively screening for signs of infection or neurovascular compromise. The correct answer is D. Focus on the patient's subjective report of pain and the objective signs of inflammation, comparing them against the expected postoperative inflammatory response for this procedure, while also actively screening for signs of infection or neurovascular compromise. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic nursing, differentiating between the expected inflammatory response to a surgical intervention and a pathological complication. The nurse must apply a nuanced understanding of musculoskeletal pathophysiology to accurately assess the patient's condition, which is critical for timely and appropriate intervention. Misinterpreting signs and symptoms can lead to delayed treatment of serious complications, potentially resulting in adverse patient outcomes, increased morbidity, and prolonged recovery. The professional challenge lies in the nurse's ability to synthesize clinical data, patient history, and knowledge of disease processes to make an informed judgment within the scope of practice. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates the patient's subjective reports of pain and functional limitations with objective findings such as swelling, erythema, warmth, and range of motion limitations. This approach aligns with best practices in orthopedic nursing, emphasizing a holistic and evidence-based evaluation. Specifically, it requires the nurse to consider the typical postoperative inflammatory response, which includes localized swelling, pain, and warmth, but also to actively screen for signs indicative of infection or other complications, such as fever, purulent drainage, increased localized pain disproportionate to expected levels, or signs of neurovascular compromise. This aligns with the nursing process: assessment, diagnosis, planning, implementation, evaluation, and the ethical obligation to provide competent and safe patient care as outlined by professional nursing standards and regulatory bodies governing nursing practice. The focus is on vigilant monitoring and early detection of deviations from the expected recovery trajectory. Incorrect approach is analysis. One incorrect approach is to attribute all postoperative symptoms solely to the expected inflammatory response without further investigation. This fails to acknowledge the potential for serious complications like surgical site infection, deep vein thrombosis, or compartment syndrome, which require immediate medical attention. Ethically, this approach breaches the duty of care by potentially delaying necessary interventions, leading to patient harm. Legally, it could be considered a failure to meet the standard of care expected of a certified orthopedic nurse. Another incorrect approach is to overreact to every minor symptom, leading to unnecessary investigations or interventions. While vigilance is crucial, an overly anxious response can lead to patient distress, increased healthcare costs, and potential iatrogenic complications. This approach, while stemming from a desire to ensure patient safety, lacks the nuanced judgment required to differentiate between normal recovery and pathological processes, potentially undermining the patient's confidence in the care provided. It may also indicate a lack of confidence in applying established pathophysiological knowledge. A third incorrect approach is to rely solely on objective data, without considering the patient's subjective experience. Pain is a subjective symptom that, when reported by the patient, must be taken seriously and investigated. Ignoring or downplaying a patient's reported pain can lead to underdiagnosis of complications and a failure to provide adequate pain management, impacting patient comfort and recovery. This violates the principle of patient-centered care and the ethical imperative to alleviate suffering. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, incorporating both subjective and objective data. This assessment should be guided by an understanding of the specific musculoskeletal disorder and the expected postoperative or post-injury course. The nurse should then compare the current findings against established benchmarks for normal recovery and known complication profiles. If deviations are noted, the nurse must escalate the concern according to established protocols, which may involve consulting with the orthopedic surgeon or other members of the healthcare team. Continuous learning and staying abreast of current evidence-based practices in orthopedic nursing are essential for maintaining competence and providing optimal patient care. Question 13. System analysis indicates a post-operative orthopedic patient reports increased pain in their affected limb, stating it feels tight and throbbing. The nurse has administered prescribed analgesia, but the pain persists at a higher level than reported earlier. Which of the following nursing interventions best reflects a comprehensive and safe approach to this situation, adhering to best practices in orthopedic nursing? Option A. Gently manipulate the cast or splint to try and relieve the perceived tightness, as this may be causing the increased pain. Option B. Perform a thorough neurovascular assessment of the affected limb, including checking for pulses, capillary refill, sensation, and motor function, while also assessing the wound for drainage or signs of infection and evaluating the integrity of the cast or splint. Option C. Document the patient's report of increased pain and the administration of analgesia, and inform the patient that this level of pain is expected after surgery. Option D. Administer a higher dose of the prescribed pain medication, as the patient's pain is clearly not controlled by the current regimen. The correct answer is B. Perform a thorough neurovascular assessment of the affected limb, including checking for pulses, capillary refill, sensation, and motor function, while also assessing the wound for drainage or signs of infection and evaluating the integrity of the cast or splint. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic nursing, balancing patient comfort and mobility with the critical need for fracture immobilization and healing. The professional challenge lies in accurately assessing the patient's response to interventions, recognizing subtle signs of complications, and advocating for appropriate adjustments to the care plan, all while adhering to established best practices and regulatory guidelines for orthopedic care. The nurse must exercise sound clinical judgment to differentiate between expected post-operative discomfort and potential adverse events. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of the patient's pain and the integrity of the fixation device. This aligns with the regulatory framework for orthopedic nursing, which mandates vigilant monitoring for signs of complications such as compartment syndrome, infection, or hardware failure. By assessing neurovascular status, wound integrity, and the patient's reported pain characteristics, the nurse is gathering essential data to inform further clinical decisions and ensure patient safety. This proactive and thorough assessment is a cornerstone of quality orthopedic care, directly impacting patient outcomes and preventing potentially severe complications. Incorrect approaches analysis. One incorrect approach fails to adequately assess the neurovascular status of the affected limb. This is a critical regulatory and ethical failure because compromised neurovascular function is a medical emergency that can lead to permanent damage if not promptly identified and treated. Omitting this assessment directly violates best practice standards for fracture care and patient safety. Another incorrect approach focuses solely on administering pain medication without a comprehensive reassessment of the patient's pain and the underlying cause. This represents a failure to address the root of the problem and could mask developing complications. Ethically, it is imperative to investigate the source of pain rather than merely treating the symptom, which could lead to delayed diagnosis and management of serious issues. A third incorrect approach involves adjusting the cast or splint without a physician's order or a clear indication of a problem with the immobilization device. This is a significant breach of professional conduct and regulatory guidelines. Unauthorized manipulation of orthopedic devices can compromise fracture alignment, impede healing, and potentially cause further injury, necessitating strict adherence to physician orders and established protocols. Professional reasoning. Professionals should employ a systematic approach to patient assessment, starting with a thorough head-to-toe evaluation, followed by a focused assessment of the orthopedic injury and its management. This includes vigilant monitoring of vital signs, pain levels, neurovascular status, wound appearance, and the integrity of any orthopedic devices. When faced with patient complaints or changes in condition, the professional decision-making process should involve 1. Gathering subjective and objective data. 2. Analyzing the data to identify potential problems. 3. Consulting relevant protocols and physician orders. 4. Communicating findings and concerns to the interdisciplinary team. And 5. implementing appropriate interventions based on evidence and clinical judgment. Continuous reassessment and documentation are crucial throughout the care process. Question 14. The efficiency study reveals that the current onboarding process for new pediatric orthopedic patients with suspected congenital disorders is leading to delays in diagnosis and intervention. As a certified orthopedic nurse, which of the following approaches best aligns with regulatory requirements and best professional practice for initiating a risk assessment for scoliosis and clubfoot in a new patient presenting with parental concerns? Option A. Immediately order advanced spinal imaging and foot x-rays for all patients with parental concerns about potential scoliosis or clubfoot to expedite the diagnostic process. Option B. Focus the initial assessment on the child's general mobility and pain levels, deferring specific evaluation of spinal curvature or foot deformities until later in the treatment pathway. Option C. Rely solely on the parent's description of the child's symptoms and medical history to initiate the referral process for specialist consultation. Option D. Conduct a thorough family history and a comprehensive physical examination, specifically assessing spinal alignment and foot structure, before determining the need for further diagnostic imaging. The correct answer is D. Conduct a thorough family history and a comprehensive physical examination, specifically assessing spinal alignment and foot structure, before determining the need for further diagnostic imaging. Explanation: the efficiency study reveals a need to streamline the risk assessment process for congenital orthopedic disorders in pediatric patients. This scenario is professionally challenging because it requires a certified orthopedic nurse to balance the urgency of early identification and intervention with the need for accurate, non-alarming communication to families, while adhering to established clinical guidelines and patient privacy regulations. The nurse must consider the potential for misdiagnosis, the emotional impact on families, and the importance of a comprehensive, multidisciplinary approach. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based risk assessment that integrates multiple data points. This includes a thorough family history, a detailed physical examination focusing on characteristic signs of scoliosis and clubfoot, and appropriate use of diagnostic imaging as indicated by clinical findings. This approach aligns with the ethical principles of beneficence and non-maleficence by ensuring that interventions are based on accurate assessments, minimizing unnecessary anxiety or treatment. It also adheres to professional nursing standards that mandate comprehensive patient evaluation and collaboration with other healthcare professionals. Regulatory frameworks for pediatric care emphasize early detection and intervention for congenital conditions to optimize long-term outcomes, which this systematic approach supports. An incorrect approach that relies solely on parental reporting without a physical examination fails to meet professional standards of care. It risks overlooking subtle but significant physical manifestations of these conditions, potentially delaying diagnosis and treatment. This could be considered a breach of the duty of care, as it neglects a fundamental aspect of nursing assessment. Furthermore, it may violate guidelines that mandate objective clinical evaluation for suspected congenital anomalies. Another incorrect approach that immediately refers all suspected cases for advanced imaging without a preliminary physical assessment is inefficient and potentially exposes the child to unnecessary radiation or cost. While imaging is crucial, its use should be guided by clinical suspicion derived from a physical examination. This approach could be seen as a failure to exercise professional judgment and could lead to overutilization of resources, which may be subject to healthcare policy regulations. Finally, an approach that focuses only on the immediate physical presentation without considering the broader psychosocial impact on the family or the long-term implications of the disorder is incomplete. Best professional practice requires a holistic view of the patient and their family, including providing education, support, and clear communication about the diagnosis and management plan. Failing to do so can lead to poor adherence to treatment and increased family distress, which are also considerations within ethical and professional guidelines for patient care. The professional reasoning process for similar situations should involve 1. Activating a systematic assessment protocol based on presenting concerns. 2. Correlating subjective information, parental report with objective findings, physical examination. 3. Determining the necessity and appropriateness of diagnostic interventions based on clinical evidence. 4. Collaborating with specialists as needed. 5. providing comprehensive education and support to the patient and family, considering the psychosocial context. 6. Documenting all findings and interventions meticulously. Question 15. Assessment of a patient reporting sharp pain specifically when attempting to abduct their arm away from their body, without any history of direct trauma, most accurately implicates which of the following anatomical considerations for further targeted nursing assessment? Option A. A potential fracture of the humerus shaft. Option B. The deltoid muscle and its role in shoulder abduction. Option C. Systemic circulatory issues affecting the arm. Option D. Generalized inflammation of the entire upper limb. The correct answer is B. The deltoid muscle and its role in shoulder abduction. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the orthopedic nurse to interpret complex patient-reported symptoms in the context of specific muscle anatomy and physiology, while also considering the potential for misdiagnosis or delayed treatment. The nurse must synthesize subjective information with objective anatomical knowledge to formulate an appropriate nursing intervention. Accurate assessment is paramount to patient safety and effective care planning. Correct approach analysis. The correct approach demonstrates best professional practice by directly linking the patient's reported sensation to the specific anatomical structures involved. Understanding that the deltoid muscle is responsible for shoulder abduction, and that pain during this specific movement strongly suggests involvement of this muscle or its associated structures, tendons, bursa, is crucial. This precise anatomical correlation allows for targeted assessment and intervention, aligning with the nursing scope of practice and the principles of evidence-based care. Regulatory frameworks for orthopedic nursing emphasize accurate patient assessment and the application of specialized knowledge to guide care. Incorrect approaches analysis. One incorrect approach might involve a generalized assessment of arm pain without attempting to localize the source. This fails to meet the standard of specialized orthopedic nursing care, potentially leading to a superficial understanding of the problem and delaying appropriate interventions. Ethically, this approach could be seen as a failure to provide competent care by not utilizing the nurse's specialized knowledge. Another incorrect approach could be to immediately assume a fracture without further specific assessment of muscle function. While fractures are a concern in orthopedic injuries, jumping to this conclusion without considering other possibilities like rotator cuff impingement or tendinitis, which manifest with specific movement-related pain, is premature and bypasses essential diagnostic steps. This could lead to unnecessary investigations or inappropriate management, violating principles of efficient and effective patient care. A further incorrect approach might be to focus solely on pain management without investigating the underlying cause. While pain relief is a critical component of nursing care, it should not supersede the assessment of the etiology of the pain. This approach neglects the core responsibility of identifying and addressing the root problem, potentially masking a more serious condition and failing to meet the comprehensive care standards expected of an orthopedic nurse. Professional reasoning. Professionals should employ a systematic approach to patient assessment, starting with a broad overview and then progressively narrowing the focus based on patient presentation and anatomical knowledge. When a patient describes pain with a specific movement, the professional should immediately consider the muscles and structures responsible for that movement. This involves recalling or referencing anatomical diagrams and physiological functions. The decision-making process should involve 1. Active listening and gathering subjective data, patient's description of pain, location, aggravating/alleviating factors. 2. Applying specialized orthopedic knowledge to hypothesize potential anatomical sources. 3. Performing targeted physical assessments to confirm or refute hypotheses. 4. Collaborating with the healthcare team for further diagnostic evaluation or treatment planning. This structured approach ensures that care is both evidence-based and patient-centered, adhering to professional standards and regulatory requirements. Question 16. Comparative studies suggest that the initial assessment of a patient presenting with acute hip pain following a fall is critical for timely and accurate management. Which of the following approaches to patient history and physical examination is most aligned with best practices for orthopedic nursing in evaluating such a presentation? Option A. Conducting a brief physical examination of the hip joint and immediately administering pain medication without a thorough history of the fall. Option B. Focusing exclusively on the visible signs of bruising and swelling around the hip, deferring a detailed history until after initial pain management. Option C, prioritizing a detailed history of the fall mechanism and associated symptoms, followed by a systematic head-to-toe physical examination with a specific focus on the affected limb, including neurovascular assessment. Option D, relying primarily on the patient's self-reported pain score to guide the physical examination, focusing only on the hip joint. The correct answer is C, prioritizing a detailed history of the fall mechanism and associated symptoms, followed by a systematic head-to-toe physical examination with a specific focus on the affected limb, including neurovascular assessment. Explanation: scenario analysis. A patient presenting with a new onset of severe hip pain following a fall requires a thorough and systematic approach to history-taking and physical examination. The challenge lies in differentiating between a simple contusion, a fracture, or other underlying orthopedic pathology, especially if the patient has pre-existing conditions or is on medications that might affect pain perception or healing. The nurse must gather comprehensive information while ensuring patient comfort and safety, and recognizing the limitations of their scope of practice in definitive diagnosis. Correct approach analysis. The correct approach involves a systematic head-to-toe assessment, prioritizing the affected limb. This includes a detailed history of the fall mechanism, impact, pain characteristics, onset, location, quality, radiation, severity, aggravating/alleviating factors, and any associated symptoms: numbness, tingling, and ability to bear weight. The physical examination should include inspection for deformity, swelling, and bruising, palpation for tenderness and crepitus, assessment of range of motion, active and passive, if tolerated, and neurovascular checks, pulses, capillary refill, sensation, motor function. This comprehensive approach aligns with established orthopedic nursing standards of care and best practices for patient assessment, ensuring all relevant data is collected to inform subsequent care planning and physician consultation. It adheres to the principle of providing safe and effective nursing care by systematically evaluating the patient's condition. Incorrect approaches analysis. One incorrect approach would be to solely focus on the reported hip pain without inquiring about the mechanism of injury. This failure to gather crucial historical context about the fall could lead to an incomplete understanding of the event and potentially miss associated injuries. Ethically, this represents a lapse in thorough patient assessment, which is a fundamental nursing responsibility. Another incorrect approach would be to perform a limited physical examination, perhaps only assessing the hip joint itself, without conducting a full neurovascular assessment of the affected limb. This oversight could result in a misdiagnosis of compromised circulation or nerve damage, which are orthopedic emergencies. This violates the nursing duty to monitor for and report changes in patient status that could lead to harm. A third incorrect approach would be to rely solely on the patient's subjective report of pain severity without objective physical findings to corroborate it. While subjective pain is important, a comprehensive assessment requires correlating subjective reports with objective data. Failing to do so could lead to misinterpretation of the patient's condition and inappropriate interventions. This deviates from evidence-based nursing practice, which emphasizes the integration of subjective and objective data. Professional reasoning. Professionals should employ a structured, systematic approach to patient assessment, starting with a detailed history and progressing to a targeted yet comprehensive physical examination. This involves active listening, critical thinking to identify key information, and a thorough understanding of orthopedic anatomy and common injuries. When faced with uncertainty or potential red flags, e.g., signs of neurovascular compromise, the professional decision-making process dictates prompt escalation of care to the appropriate physician or specialist, adhering to institutional protocols and scope of practice guidelines. Question 17. Risk assessment procedures indicate a patient recovering from orthopedic surgery is exhibiting signs of significant postoperative pain, including grimacing, guarding the surgical site, and reporting a pain score of 7/10 when asked. However, the patient adamantly refuses any further opioid pain medication, stating they don't want to be drugged up and are concerned about addiction. As the certified orthopedic nurse, what is the most appropriate immediate course of action? Option A. Administer a prescribed opioid analgesic to manage the patient's evident pain, as their current level is impacting their recovery. Option B. Explain to the patient the importance of adequate pain control for healing and mobility, explore their specific concerns about opioids, and discuss alternative pain management strategies, including different medication classes or lower doses. While reassessing their pain, option C, inform the patient that their refusal is detrimental to their recovery and strongly encourage them to take the medication, emphasizing the risks of delayed healing if pain is not controlled. Option D, document the patient's refusal of pain medication and continue routine postoperative monitoring, offering non-pharmacological comfort measures. The correct answer is D. Document the patient's refusal of pain medication and continue routine postoperative monitoring, offering non-pharmacological comfort measures. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in orthopedic nursing, balancing patient autonomy and comfort with the need for objective clinical assessment and adherence to pain management protocols. The patient's expressed desire to avoid medication, despite clear signs of significant postoperative pain, creates a conflict between respecting their wishes and fulfilling the nurse's duty of care to alleviate suffering and promote healing. The challenge lies in discerning whether the patient's refusal is based on informed understanding, fear, or potential misunderstanding of the medication's benefits and risks, and in navigating this without coercion or dismissal of their concerns. Correct approach analysis. The correct approach prioritizes a thorough, empathetic, and educational intervention. It involves a detailed assessment of the patient's pain, including its location, intensity, character, and impact on function, to establish an objective baseline. Crucially, it necessitates open communication with the patient to understand the reasons behind their refusal. This includes exploring potential fears or misconceptions about pain medication, discussing the benefits of adequate pain control for recovery, e.g., mobility, wound healing, reduced risk of complications, and reiterating the available options and their expected effects. The nurse must also assess the patient's cognitive status and capacity to make informed decisions. If the patient understands the risks and benefits and still refuses, their autonomy must be respected, but this decision must be documented thoroughly, and the patient should be continually reassessed and offered alternatives. This aligns with ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy, as well as professional nursing standards that mandate comprehensive pain assessment and management. Incorrect approaches analysis. One incorrect approach would be to immediately document the refusal and cease further pain management interventions, without attempting to understand the patient's rationale or providing further education. This fails the principle of beneficence by not actively seeking to alleviate suffering and potentially violates professional standards for pain management, which require ongoing assessment and intervention. It also disrespects patient autonomy by not engaging in a dialogue to ensure the refusal is truly informed. Another incorrect approach would be to override the patient's wishes and administer pain medication without their consent, even if the nurse believes it is for their own good. This is a direct violation of patient autonomy and the legal and ethical principle of informed consent. It constitutes battery and is a serious breach of professional conduct and regulatory guidelines. A third incorrect approach would be to dismiss the patient's pain as exaggerated or psychosomatic without a thorough objective assessment and exploration of their subjective experience. This demonstrates a lack of empathy and professional judgment, potentially leading to undertreatment of pain and negatively impacting the patient's recovery and well-being. It fails to meet the standards of care for pain assessment and management. Professional reasoning. Professionals should employ a systematic approach that begins with a comprehensive assessment of the patient's pain. This should be followed by open-ended, empathetic communication to understand the patient's perspective and the reasons for their refusal. Education about the importance of pain management for recovery, the benefits and potential side effects of medications, and alternative non-pharmacological interventions is essential. The nurse must then assess the patient's capacity to make an informed decision. If the patient is capable and understands the information, their autonomous decision should be respected and documented. If there are concerns about capacity or understanding, further assessment or consultation with the healthcare team may be necessary. Throughout this process, maintaining a therapeutic relationship built on trust and respect is paramount. Question 18. To address the challenge of optimizing recovery for a patient with a suspected ligamentous tear and concurrent tendinopathy, which approach best integrates understanding of connective tissue biomechanics and healing principles within the certified orthopedic nurse's scope of practice? Option A. Implement a rehabilitation program that gradually increases load-bearing and range of motion exercises, focusing on proprioception and controlled strengthening of surrounding musculature, while educating the patient on the distinct healing timelines and stress tolerances of ligaments and tendons. Option B. Focus solely on managing the patient's pain symptoms through pharmacological interventions, deferring all discussions about functional recovery and tissue healing to the physical therapist. Option C. Immediately initiate aggressive stretching and strengthening exercises for the affected joint to rapidly restore full mobility and function, assuming the body will adapt quickly to increased demands. Option D. Administer pain medication as prescribed and advise the patient to rest the affected limb until all pain subsides, without further specific guidance on activity modification or rehabilitation. The correct answer is A. Implement a rehabilitation program that gradually increases load-bearing and range of motion exercises, focusing on proprioception and controlled strengthening of surrounding musculature, while educating the patient on the distinct healing timelines and stress tolerances of ligaments and tendons. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified orthopedic nurse to interpret and apply complex physiological knowledge regarding connective tissues to a patient's care plan. The challenge lies in accurately assessing the patient's condition, understanding the specific roles and vulnerabilities of ligaments, tendons, and cartilage, and then formulating an evidence-based, patient-centered approach that aligns with best practices and regulatory guidelines for orthopedic nursing. Misinterpreting the function or injury of these tissues can lead to suboptimal treatment, delayed recovery, or even iatrogenic harm, underscoring the need for precise clinical judgment. Correct approach analysis. The correct approach emphasizes a comprehensive assessment of the patient's functional limitations and pain, correlating these findings with the specific biomechanical roles of the affected connective tissues, ligaments, tendons, cartilage. This involves understanding how damage to each tissue type impacts joint stability, range of motion, and load-bearing capacity. The approach prioritizes patient education on the healing process and the importance of adherence to prescribed rehabilitation protocols, which are critical for restoring function and preventing re-injury. This aligns with the certified orthopedic nurse's scope of practice, which includes patient assessment, education, and the implementation of evidence-based care plans, all within the framework of established orthopedic nursing standards and patient safety regulations. Incorrect approach is analysis. Focusing solely on pain management without addressing the underlying structural integrity of the connective tissues represents a failure to treat the root cause of the patient's functional deficit. This approach neglects the biomechanical implications of ligamentous laxity, tendinous tears, or cartilaginous defects, potentially leading to chronic instability or further damage. It also fails to meet the regulatory expectation of providing holistic and effective care that promotes long-term recovery, prioritizing aggressive, early mobilization without considering the specific healing characteristics and load-bearing tolerances of damaged ligaments, tendons, or cartilage is a significant regulatory and ethical failure. Ligaments and tendons require a period of controlled stress to remodel and strengthen, while cartilage has limited intrinsic healing capacity. Premature or excessive stress can disrupt the healing process, lead to scar tissue formation that compromises function, or exacerbate cartilage degeneration, directly contravening the principle of do no harm and failing to adhere to established orthopedic rehabilitation protocols. Adopting a passive approach, such as solely relying on physician orders for medication, and rest without active nursing assessment and patient education regarding the specific connective tissue injury, falls short of the professional standard. While physician orders are paramount, the certified orthopedic nurse has a responsibility to understand the rationale behind these orders, assess their effectiveness, and actively engage the patient in their recovery. This passive stance fails to leverage the nurse's expertise in patient education and monitoring, potentially leading to patient noncompliance and suboptimal outcomes, which can be viewed as a breach of professional duty of care. Professional reasoning. Professionals should approach such situations by first conducting a thorough patient assessment, integrating subjective reports of pain and functional limitations with objective findings. This assessment must be informed by a deep understanding of orthopedic anatomy and physiology, specifically the distinct roles and healing properties of ligaments, tendons, and cartilage. The next step involves correlating these findings with the patient's diagnosis and the proposed treatment plan, ensuring that the plan is biomechanically sound and respects the biological constraints of tissue healing. Patient education is a critical component, empowering the patient with knowledge about their condition, the rationale for treatment, and the importance of adherence to rehabilitation. Continuous monitoring of the patient's progress, response to treatment, and any signs of complications allows for timely adjustments to the care plan, always in collaboration with the healthcare team and in accordance with regulatory requirements and ethical principles. Question 19. Quality control measures reveal that a significant number of patients diagnosed with osteoporosis are not consistently adhering to their prescribed calcium and vitamin D supplementation or weight-bearing exercise regimens. As a certified orthopedic nurse, which of the following approaches would best address this gap in patient adherence and promote long-term self-management of their condition? Option A. Provide a brief verbal overview of osteoporosis management during routine clinic visits, assuming patients will seek further information if needed from online resources. Option B. Develop individualized care plans that incorporate interactive teaching sessions, utilizing visual aids and the teach-back method to confirm patient understanding of medication benefits, dietary recommendations, and safe exercise techniques, with scheduled follow-up calls to reinforce key messages. Option C. Rely on the primary care physician to provide all necessary education regarding osteoporosis management, with the nurse's role limited to administering prescribed medications. Option D. Implement a standardized, one-time educational session for all newly diagnosed osteoporosis patients, providing them with a comprehensive written information packet and instructing them to review it thoroughly. Correct answer is D. Implement a standardized, one-time educational session for all newly diagnosed osteoporosis patients, providing them with a comprehensive written information packet and instructing them to review it thoroughly. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified orthopedic nurse to critically evaluate the effectiveness of patient education regarding a chronic degenerative condition. Osteoporosis, within the context of established best practices and regulatory guidelines for patient care and health promotion. Ensuring patients understand and adhere to management plans for conditions like osteoporosis is crucial for preventing fractures and maintaining quality of life. But patient comprehension can be variable and influenced by numerous factors. The nurse must discern which educational approach is most likely to lead to sustained behavioral change and positive health outcomes, aligning with the principles of patient-centered care and evidence-based practice. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a multimodal, individualized, and interactive educational strategy. This aligns with the regulatory framework for nursing practice, which mandates that nurses provide competent, evidence-based care and patient education. Specifically, guidelines emphasize the importance of assessing patient understanding, tailoring information to individual needs and learning styles, and reinforcing key messages through various channels. For osteoporosis, this means not only explaining the disease process and medication adherence, but also focusing on practical lifestyle modifications such as nutrition and safe exercise, which are critical for long-term management. The use of visual aids, demonstration, and opportunities for the patient to ask questions and demonstrate understanding, teach-back method, are recognized as highly effective in improving health literacy and adherence, thereby reducing the risk of complications like falls and fractures, which is a core ethical and professional responsibility. Incorrect approaches analysis. One incorrect approach fails by relying solely on a single, passive method of information delivery, such as providing a written pamphlet. This is professionally unacceptable as it does not account for varying literacy levels, cognitive abilities, or learning preferences of patients. Regulatory guidelines for patient education stress the need for clear, understandable information and verification of comprehension, which a pamphlet alone cannot guarantee. It also neglects the interactive and supportive role of the nurse in addressing patient concerns and reinforcing learning. Another incorrect approach is to assume that a brief verbal explanation is sufficient, without any follow-up or assessment of understanding. This is ethically problematic as it can lead to misinformation or incomplete understanding, potentially resulting in poor adherence to treatment and increased risk of harm. Professional standards require nurses to ensure patients are adequately informed to make decisions about their health and to manage their conditions effectively. This approach falls short of that standard by not verifying comprehension or providing opportunities for clarification. A third incorrect approach might involve focusing exclusively on pharmacological interventions without adequately addressing the crucial role of lifestyle modifications in managing osteoporosis. While medication is important, comprehensive management of degenerative diseases like osteoporosis requires a holistic approach that includes diet, exercise, and fall prevention. Failing to educate on these aspects is a failure to provide complete and effective care, potentially leading to suboptimal outcomes and contravening best practice guidelines that advocate for integrated care plans. Professional reasoning. When faced with a scenario involving patient education for a chronic condition like osteoporosis, a certified orthopedic nurse should employ a systematic decision-making process. This begins with assessing the patient's current knowledge, beliefs, and readiness to learn. Next, the nurse should identify specific learning objectives tailored to the individual's needs and the disease management plan. The educational content should be delivered using a variety of methods, incorporating visual aids, demonstrations, and clear, jargon-free language. Crucially, the nurse must actively involve the patient, encouraging questions, and utilizing the teach-back method to confirm understanding. Finally, a plan for follow-up and reinforcement of learning should be established, ensuring the patient feels supported in their self-management journey. This approach ensures that education is not merely an information dump, but a collaborative process aimed at empowering the patient for effective self-care, thereby upholding professional and ethical obligations. Question 20. Stakeholder feedback indicates a need to refine nursing practices regarding pain management for postoperative orthopedic patients with a documented history of opioid misuse. Considering the certified orthopedic nurse's role in patient care and adherence to regulatory frameworks, which of the following approaches best balances effective pain relief with the imperative to prevent diversion and misuse of controlled substances? Option A. Administer prescribed opioid analgesics as needed for pain, focusing on achieving a pain score of 0, and document any requests for early refills. Option B. Administer scheduled opioid analgesics at higher doses than typically prescribed for similar procedures to ensure the patient is comfortable and less likely to request additional medication. Option C. Implement a multimodal pain management strategy that includes non-opioid analgesics, non-pharmacological interventions, and judicious use of opioids for breakthrough pain, with close monitoring for efficacy and signs of misuse. Option D. Withhold opioid analgesics entirely due to the patient's history of misuse, relying solely on over-the-counter pain relievers. The correct answer is A. Administer prescribed opioid analgesics as needed for pain, focusing on achieving a pain score of 0, and document any requests for early refills. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the orthopedic nurse to navigate the complexities of pain management for a post-operative patient with a history of opioid misuse. Balancing the patient's legitimate need for pain relief with the risk of diversion or misuse of controlled substances demands a high level of clinical judgment, adherence to established protocols, and effective communication with the healthcare team. The nurse must consider not only the immediate pharmacological intervention, but also the long-term implications for patient safety and recovery. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, multimodal pain management strategy that aligns with current evidence-based guidelines for postoperative orthopedic pain. This approach acknowledges that effective pain control often requires a combination of pharmacological and non-pharmacological interventions. Specifically, it involves utilizing non-opioid analgesics as a first-line treatment, reserving opioids for breakthrough pain, and carefully titrating them. This strategy minimizes opioid exposure, reducing the risk of dependence and adverse effects, while still ensuring adequate pain relief. It also emphasizes ongoing assessment and communication with the interdisciplinary team, which is crucial for adapting the pain management plan as the patient progresses, and for addressing any emerging concerns related to misuse or diversion. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Incorrect approach is analysis, One incorrect approach would be to solely rely on high-dose opioid analgesics to manage the patient's pain, despite the history of misuse. This fails to adhere to best practices in pain management, which advocate for a multimodal approach in minimizing opioid use. Ethically, this could be seen as a failure of non-maleficence, as it significantly increases the risk of adverse events, including respiratory depression and the potential for relapse into substance misuse. Regulatory frameworks often mandate the use of the lowest effective dose and the exploration of alternative pain management strategies. Another incorrect approach would be to withhold adequate pain medication due to fear of the patient misusing it, without implementing alternative pain relief strategies or engaging in a thorough risk assessment. This would be a failure of beneficence, as it neglects the patient's legitimate need for pain management, potentially hindering their recovery and increasing their suffering. It also fails to uphold the professional responsibility to advocate for the patient's well-being. Ethically, this could be considered a form of patient neglect. A third incorrect approach would be to administer prescribed opioid medication without regular reassessment of pain levels or monitoring for signs of misuse or diversion. This demonstrates a lack of diligence and adherence to the principles of safe medication administration and patient monitoring. Regulatory guidelines for controlled substances require vigilant tracking and assessment to prevent diversion and ensure appropriate use. Failure to do so can have serious legal and ethical ramifications. Professional reasoning. When faced with a post-operative orthopedic patient with a history of opioid misuse requiring pain management, the professional decision-making process should involve the following steps. 1. Thorough patient assessment. Understand the patient's pain level, location, and characteristics, as well as their history of substance use, including any formal treatment or recovery efforts. 2. Consultation with the interdisciplinary team. Collaborate with physicians, pharmacists, and potentially addiction specialists to develop a comprehensive pain management plan. 3. Adherence to evidence-based guidelines. Prioritize non-opioid analgesics, physical therapy, and other non-pharmacological interventions. 4. Judicious use of opioids. If opioids are necessary, use the lowest effective dose for the shortest duration, with clear protocols for breakthrough pain management and regular reassessment. 5. Vigilant monitoring. Continuously assess pain relief, monitor for adverse effects, and be alert for any signs of misuse or diversion. 6. Patient education and engagement. Involve the patient in their pain management plan, educate them about the risks and benefits of medications, and encourage open communication. 7. Documentation. Meticulously document all assessments, interventions, and patient responses. This systematic approach ensures that patient care is safe, effective, and ethically sound, while also complying with regulatory requirements for pain management and controlled substance handling.